Pennsylvania has a notorious distinction of being #1 in the nation, probably #1 in the world, in cases of Lyme disease. It is a devastating disease that we should do well to support Chairman Rapp's bill, the underlying bill, that would mandate that insurance companies treat long-term antibiotic. I'm all for that. My amendments, I believe, in my heart, make this bill better. And it makes the bill better because it does get some stakeholders to the table to say, yes, we can support it. But more importantly, it removes some confusion. So first of all, unbeknownst to me and surprising to me, there is no definition of Lyme disease that people agree to. On one side, there was the Centers for Disease Control definition from 2017 case, but it doesn't include surveillance. There's a West Virginia definition that is in the underlying bill that makes one very important distinction. My amendment, the first part, uses a definition of Lyme disease that is in Act 83 of 2014 that this body passed and that became law. And that's that a licensed physician, a physician assistant, or a nurse practitioner are the ones that can diagnose and prescribe medication for the treatment of Lyme disease, short-term or long-term. So the change that's in the bill that is problematic for me is that we use the term healthcare practitioner instead of physician, physician's assistant, or licensed nurse practitioner. The 3 people in the Commonwealth of Pennsylvania that can actually prescribe drugs are the ones that would be able to prescribe these drugs. And I don't understand what the problem is when there is any bit of confusion, why we wouldn't clarify it. And that's what my amendment does. The second part is that in the definition of Lyme disease, it starts with those 3 people in Act 83, and then it says, and any other case that doesn't, I'll read the language, any other case that the clinical diagnosis of a patient by a licensed physician, a physician's assistant, or certified registered nurse practitioner of the presence or signs or symptoms compatible with acute, late-stage, persistent infection. And it goes on to say, the term includes infections that meets the surveillance criteria established by the Centers of Disease Control and Prevention and other acute and persistent manifestations of such an infection as determined by a physician. That's the definition in Act 83. That's what my amendment does, as opposed to the language that says a healthcare practitioner. And now we have to go, and in the bill, it defines a healthcare practitioner as a healthcare practitioner as defined in Section 103 of the Act of July 19th, 1979, known as the Healthcare Facilities Act, who is authorized to prescribe medication in the Commonwealth. So that might be enough. Because it says who can prescribe medication, that might be enough. But look at the definition from 1979. A healthcare practitioner is an individual who is authorized to practice some component of the healing arts by a license, permit, certificate, or registration issued by a Commonwealth licensing agency or board. And so I'm trying to remove who can diagnose whether or not there's Lyme, which I think we all are in agreement that it should be diagnosed by a physician, a nurse practitioner, or a physician's assistant. And I think my amendments clarify that. It makes it a better bill, and that's why I'm asking you for your support. But I'm happy to answer any questions and take interrogation. Thank you, Mr. Speaker.
Mr. Speaker, I am trying to get clarity myself. Oh, and the reason for changing out the verbiage licensed healthcare provider and inserting instead physician, physician assistant, and certified nurse practitioner. I ask this question because over the last several years, some of us have worked really hard, offered very successful amendments that in fact have done the reverse to make sure that the entire appropriate healthcare team is functioning to their fullest extent possible. So if perhaps it's in this 2014 Act that's being cited, perhaps that was an oversight where we didn't do that inclusively, but I am concerned, and I'd like to understand the maker's concern for replacing that language? Who does the maker think could also be involved in the discussion, and why would we do that?
You may proceed, sir.
Yeah, I'm being redundant, but just to be clear, there's no healthcare provider in the bill. It's healthcare practitioner.
Practitioner.
And the definition of the healthcare practitioner is from 1979. It's cited in the bill. It's from 40 years ago, which includes anyone who is authorized to practice some component of the healing arts. Now, there are lots of healing arts that we may or may not recognize, or we may or may not say, well, that's, look, I mean, you can go to a chiropractor, you can go to a physical therapist, you can go to Reiki, you can go to massage therapy. There are lots of healing arts that provide great relief of pain and great health care to the people of the Commonwealth of Pennsylvania. But only 3 types of people in Pennsylvania are allowed to prescribe medication. Those are physicians, nurse practitioners, and physician's assistants. And they're the only ones that should be able to diagnose and treat for Lyme disease. There isn't anybody else saying we can't do that. So what's the problem with making that definition consistent with Pennsylvania law, as opposed to opening up for some debate that someone who says, I practice healing arts that may not be recognized by any physician group, that I can now diagnose for a very serious disease. Half of all the tests on Lyme disease in Pennsylvania come back false positive. Half of the people that are tested for Lyme disease are told, you don't have it. And then they go and end up going, I mean, years of chronic pain, years of thinking that there's something wrong with them and the doctor won't tell them. Why not have the physicians doing this diagnosis? Why would you open it up to anybody who's involved in a component of the healing arts? And I'm not being critical of non-physicians, but physicians, nurses, nurse practitioners, and physician's assistants. That's reasonable. So that's where I am. And I know you're as concerned about this as I am.
Just so broadly, bear with me, the bill itself provides long-term coverage for Lyme disease if approved by a broad category of medical provider, and your amendment narrows the category of people who can authorize this long-term coverage. It narrows it to just physicians. In other words, your amendment says a physician needs to authorize this long-term coverage for an insurance company to carry it. Is that the essence of, for an insurance company to cover it? Is that the essence of your amendment?
No, and I would defer to the maker of the underlying bill that her bill doesn't narrow it either. Right now, there are only 3 people in Pennsylvania that can diagnose or prescribe medication, and those are the 3 that I'm trying to clarify. If you go through the definition and you get into what is recognized by the Centers for Disease Control and Prevention, that would be covered. The term includes infection that meets the surveillance criteria established by the Centers for Disease Control and Prevention, which is a good thing. That's broad. And other acute and persistent manifestations of such an infection as determined by a physician. So after you meet all those other definitions, if this is an evolving disease, an evolving science in diagnosing this disease, if you don't meet any of that criteria, your one physician can say this is Lyme disease and the insurance should cover it. So it doesn't narrow it. My fear is, with the definition of healthcare practitioner, it's not the intention of the maker of the bill, but that could open it up for someone who's not a physician to diagnose, which then could cause violations of our other scope of practice and other laws and create confusion in the marketplace and also with the patient and the healthcare provider, or practitioner, which is the word they use.
So your amendment is, the intent is to safeguard against a nurse or a physical therapist or another medical person who's not a physician from authorizing this treatment.
Yes, to clarify that, because I believe that the underlying maker, the underlying bill, believes that's already in the bill. I just think it needs to be clarified.
Understood. Thank you.